So I know what to serve my kids this weekend because they love bacon on the weekend mornings. Is it all meat or is it processed meat?
For this report, it's about processed meat, but I actually think you're going to see that higher calorie foods, higher fat foods, all of these are contributing indirectly, if not directly, to the cancer problem because of the link through obesity.
Okay, so go ahead.
When we say processed, that's a key component here also. What does that mean? Smoked? You know, what gets
In this
into that
case,
category?
they were referring to smoked meats and salting of meats, which, by the way, salting of foods has been a known cancer risk going back for more than a century. Japanese diet with lots of salted fish was famously associated with gastric cancer decades earlier.
But this report also includes red meat, specifically. Let me ask you, I mean, we've been smoking and curing meat for since time immemorial. Is it because of modern techniques? Is all processed meat created equal if you're smoking at home, like some of the fellas here
I got
do?
a friend smoking some bluefish for me
Yeah.
right now. Is it going to kill me, Doc?
You know what
Well,
I mean?
this is about red meat, but you know, you're touching on one of the great public health advances of the last century, the refrigerator. We called it the Frigidaire effect. When the electric refrigerator came out in the last century, rates of gastric cancer in the United States fell precipitously. Absolutely, because we didn't salt.
Okay, so how much meat or processed meat can we eat a week without increasing our cancer risk?
I'm not certain that there's a number for that. The 50 grams that they describe per day is associated with an 18% increase in risk, but likely, as you reduce the amount, you reduce the elevation in risk, but I'm not sure you could get to zero
Hot
unless you
dog
go
is
to zero.
50 grams,
You'd have to weigh them each one.
right?
So if you
Sounds
hear
like a
someone,
lot.
because somebody at home's going to say, okay, we'll switch over to turkey bacon instead of regular
Yeah.
bacon. Same problem, essentially, because it would still be cured meat.
Maybe,
correct?
maybe not. This report addressed red meat and this processing and this particular product, so I think we'd have to wait and see. for
Smoked
others.
tofu. I'm just trying to
You're
find an
trying.
option.
You're trying.
Presumably less risk.
Presumably
Okay,
less
so
Presumably.
I mean, what are we supposed to do with this?
Well,
Are we
again, I
supposed
think
to
this
change
brings
something?
us back to where we started. An 18% increase in risk is a small increase in risk in public health circles. So fundamentally, the argument really is, why do we eat meat? And the only reason some people eat meat is it tastes good. And that's a personal choice. This is not the riskiest thing most of us are doing. It's more important, in my opinion, to focus on a calorie-restricted diet,
Right.
on increased exercise, healthier energy balance. These are the things in the long run that are going to limit our cancer risk.